From Halifax?
Yeah.
Oh, wow.
Yeah.
Thank you.
Because she's so excited about, she didn't put words in her mouth, but when I reached out to her, I heard she had run an animal first aid class down in southern Vermont, and I said, oh my God, how do we get one of those up here? There had just been a NBC with Mervis where a dog died, and I was like, what do you do if you come across, you're on a call, there's a fire, there's any sort of animal that's on scene that you feel really bad for and you want to help. And she's like, I want to come up. Anybody who wants to learn about animal first aid, I want to teach. So here she is. I'm super excited about this. We also have some other people here. I know that going around the room, hi, I'm so-and-so, that would be helpful. Because we have also some people here that are from the disaster animal response team from Chittenden County and from Central Vermont, which I didn't know anything about them either until I heard about this class. And I think that they would probably be really helpful for us as well. So it seems like there's like a lot of EMS people over here, and a lot of people, and a lot of CBMC people. So just super quick.
Well, I really am, as Ellen suggested, I really am super happy to be here because I'm really, really happy to see so many people wanting to learn how to do first aid for animals. I would wish that every pet owner could know what I'm going to talk about tonight. But this is also something of a hybrid talk because I knew that there would be both pet owners and first responders here. And so I'm going to cover a big range of topics. And hopefully you'll learn some things from it, and hopefully also it might inspire you to go and learn more. Let's see. Oh, so when I was putting this talk together, I had a flashback to when I was a little kid. And it was June, it was the last day of school. And my teacher said, I want you children to have a wonderful summer, and I want you to have a safe summer. So I'm going to show you a little movie. So she shows us this movie, and in the first scene, there's somebody drowning. And then in the next scene, there's a little kid whose balloon has popped, gone down her throat, and she's choking to death. And in the third scene, someone is holding onto a wire and steps into a puddle by mistake, and now they can't let go, and it's a hot wire, and they're getting electrocuted. And in every scene, somebody comes racing in, does something really quick, and everything's fine. And I was like, wow, this movie ruined my summer. Because from then on, I kind of thought, at any moment, anything horrible could happen, and I will have no idea what to do. And so it just wasn't until years later that I understood that it takes a lot more than watching a movie or coming to a talk. It takes a lot of learning. And it takes, most of all, I would say, it takes understanding why you would do what you do and not do it some other way. And then it takes practice and more practice until it comes naturally to you to do the right thing. All of which is to say that this talk is really just an introduction, even though I'm going to cover a lot of topics. I'm going to cover, everything from how to make a proper bandage to how to perform CPR on an animal. And basically going to cover everything short of alien abduction. And I just don't know how to treat that, so I had to leave that one out. It's a lot of material, and I'm just going to breeze through it all. And then I hope that what will happen is you're going to go home and you're going to get online, and you're going to read, watch YouTube videos, run scenarios in your head, which you guys probably have tons of practice at doing. Just do it with animal first aid. And then quiz yourself, and quiz yourself some more until you reach that point where you're confident that you know what to do in any situation. That's a really good feeling to have. So that would be the goal. So let's get started.
Question? Has anybody been either at home or on a call actually had a situation with an animal that you either took care of or wish that you could have? Or is this you have?
No.
What kind of stuff?
Oh God, this was like 15, 20 years ago. I was like still in paramedic school and I was working EMS, and my partner and I were driving back from a call, and we see a dog get hit by a car. And I like dogs more than I like people, so we stopped in the middle of in the road, put our red lights on, we started treating the dog. Well, we have a pretty good idea of how to treat people at the time, and we kind of got the dog out of the road, and we kind of really didn't have a systematic approach of how to do, you know, kind of an exam on the dog, and kind of just lung it. The dog still died right there. We had to call animal control and whatnot, but it was one of the few moments where I felt powerless, and I didn't really know what to do. I was like, shit, if this was a person, I'd have a pretty good idea what to do, and felt pretty bad for the dog.
Right, exactly, yeah. That feeling of helplessness or powerlessness is just the worst, isn't it? I mean,
It's
that's,
just a cute dog.
yeah. So hopefully, after learning some of this material, you won't have that feeling anymore. So I'm going to start to go through a process of what you would do, starting with, of course, assessing the animal. And that really starts with assessing the situation, as you would do in any call that you might make. First, making sure that the situation is not still dynamic, that the animal is still getting worse. And whatever you do, of course, first you're trying to stop that from ongoing. And then, in most cases, it might be pretty obvious what's going on. You've responded to a house fire, you've responded to a car accident. You know things just happened, and a little while ago everything was fine, and now it's a disaster. But that's not always the case. Sometimes you'll arrive at a situation and you don't know how long has this animal been seizuring? How long was that dog stuck in the swimming pool that he couldn't get out of? And so a little bit of history taking might actually be appropriate. What did the dog ingest? Do they know? So sometimes history is a piece of it. And then the other part that's just part of your preliminary approach is to think about being safe. Because an injured animal is a dangerous animal. No matter how gently you approach, even if you're the owner approaching your own animal, if it's really hurting, it's not necessarily going to assume that you're there to help. And so one of the things that I do want to show you today is some methods of safe restraint. And I just ask you to be really aware. Just never trust an animal to just understand that you're there to help them. Unfortunately, they won't. By the way, I should have told you a little bit about the structure of what I'm planning to do, which is I'm going to talk your ears off for about an hour, maybe a little less. And then we're going to do a demo time. And I'll start that demo with a few methods of safe restraint. And then I just want to show you a couple of things about things like identifying the femoral pulse on an animal. And then we're going to go into bandaging. And those of you who do bandaging all the time, you probably don't need that part, and I can just explain to you quickly the basic differences between humans and animals. And then don't feel that you have to stick around. I know this makes kind of a long day for you guys if you've worked all day. But you're welcome to, and I brought materials and a bunch of animals for us to play with. So that's my plan for the night. So let's see. So you're going to start, of course, with a physical exam once you've done that preliminary that I told you about. And that basic first part of your exam is going to be heart rate, respiratory rate, checking the gum color, and assessing their level of consciousness. You know, are they disoriented? Are they focused? Are they ataxic? Are they staggering around? Are they collapsed? Can they get up? And are there major wounds? And if you're able to proceed beyond that for further exam, in other words, you're not having to immediately intervene and stop this hemorrhage from occurring or whatever the situation is, then you'd go into the secondary phase of your physical exam. And that would be assessing the animal's hydration, checking eyes and ears. I'm going to go into some detail on that, on each of these things as we go through specific problems that occur. Checking the abdomen, and that's looking both for, of course, again, looking for wounds, but also looking for whether the abdomen is swollen. Is the animal very painful? You gently palpate the animal's abdomen and they respond as though it's painful. Assessing their gait, are they able to walk normally? And again, are they ataxic and coordinated, confused, or are they holding up one leg, or what symptoms might you see related to ambulation? And then finally, checking their temperature, rectal thermometer. You want to have a thermometer that you just label animals only, and although do use a sleeve, of course, but nonetheless, it's kind of nice to know, and because it's going to be rectal. And this is particularly important if your animal is hypothermic or if you're treating, heat stroke or severe hypothermia. You do need to know that starting temperature. So that's the basics of your physical. Yeah.
Yeah.
Are you gonna give us ranges, or is that listed in here?
Yeah, I was just about to say, see,
Okay, the last page. Oh.
ranges! Darn it! I do wish I could display this for you, but yeah, that is in the back of your handout. I've got some normal values for heart rate, respiratory rate. And what I would actually suggest that you do with that is cut it out, laminate it, and put it in with wherever you have your first aid supplies. Because you're not going to remember those numbers, and you're not going to have them handy unless they're right where you're bandaging and you know your immediate response materials are. So that's what I like to do with that info. The next thing that I want to say, oh yeah, go ahead.
Sorry, real quick question.
Sure.
What are the legal ramifications of us treating, because we don't obviously hold any veterinary
Right.
medicine degrees or have any of those certifications or licensures, what if any, are there any barriers for us providing
Yeah.
first aid within our scope to
Super
an animal?
question. You are protected by Good Samaritan law.
Even with animals?
Yes, you are. And really what it comes down to, in our money-focused culture, if you haven't charged for what you did, you can't be sued for it because, you know, all right? And you haven't done anything with malice. So I really think that I would, you know, whatever your training is, intervene to the level of your abilities, you know, knowing your limitations. And yes, go ahead and intervene. I do not imagine that there's any way you would be held liable. But that's a good
I tried to look
question.
into whether you could use some of your meds, but sadly.
I would
not.
imagine probably not because the formulations and, yeah, plus I would be very wary of doing certain advanced interventions or medications on because we don't know the landmarks, we don't know,
Yeah.
you know, the physical, obviously subtleties and differences with animals to
Yeah.
do that. And I wouldn't feel confident doing that.
Yeah, no, I wasn't, thanks for raising the question, because I wasn't thinking in terms of, you're going to give epinephrine. No, you don't want to do that, because you're right, you don't know their anatomy, you don't know their normal physiologic values.
Well, plus, I'm sure the concentrations are wildly out of.
Everything's different,
Yeah.
everything's different, yep. The worst mistake some people make is assuming that it's just a person with fur, and their physiology is so different that that's not a safe assumption. But, yeah.
So
was it?
having the locations of the nearest emergency vet, though, for wherever your areas are, you know, if there's one in your town. Like, I know in Burlington, it would be Bev's.
I think that's the
Not
closest
sure
one
who
right
would be.
now. There are some situations where services have been allowed or taken upon themselves to transport an injured animal to one of the emergency.
Also worth noting, because I ran a code with the dog in my rig and had no clue what I was doing. So I actually asked Capital West to patch in a veterinarian, and they got Bev's on the phone.
Oh, wow.
And we just put them on the radio, and my partner and I worked the dog, and we intubated, we gave epi, we had Zol on them. Didn't survive, but we worked it like it was an infant.
Right.
Fantastic.
And you did that with a vet on.
And we did with the vet on the phone, and really
Yeah,
all the vet,
yeah, that's
you know, it
great.
was more just like, okay, I've got 1 to 10,000 and 1 to 1,000, which one and how much?
Right,
The dog's
exactly.
about,
Nice.
you know, 15 kittings.
Nice.
And then I can intubate, I can tube, I can eye gel, I can king. What do you recommend?
Right, nice.
And it was just the doubtful questions, because it's not a human, they just clarified. And, you know, just otherwise just treated it like it was a PD case.
That's super.
That's good, that's great.
But Bev's was more than happy to get on the phone. And they were more than happy to volunteer they were like, when you're done with all this, because we eventually called it, they're like, if you or the owners need to just talk to somebody, call us back.
Right.
Does all say shock advice?
Zoll did not
Did
say,
not say shock.
did not say shock advised, but I wasn't using an AED, I was using the full monitor, and keeping pads on it was a little difficult, but.
Yeah.
It's really rare that you end up shocking dogs and cats versus in humans. I think it's a lot more common when you're doing CPR. It's not very effective.
You're saying it's not effective in animals, or specifically dogs?
It's really rare that they go into BFib or AFib versus they're just like asystole or just pulseless asystole.
Any particular reason why?
Their makeup, I don't know. The physiology is so rare that we end up actually having to use a shocking.
Morgan's a vet tech at Bev, so.
Yeah.
Yeah, and so the logical thing to follow all of that with is to say what I was going to say next anyway, which is almost anything that you respond to is going to be a situation that the animal should be followed up with care at a veterinary hospital. Because even if you really treated an injury pretty well, it might need more definitive care at a clinic. And the even more important thing that I want to tell you is that there are some conditions, some emergencies that you might respond to where it appears that everything's now fine. You know, the animal has stopped coughing, the animal's breathing normally, color is good, everything seems like, okay, it's all right now. And those are sometimes your most dangerous ones, because those are the cases where 24, 48 hours later, that animal has life-threatening pulmonary edema. So I would say really pretty much any time that you're doing other than just treating a bee sting or a very minor wound, you're going to want to consider the need to follow up with veterinary care. So I'm going to start with lacerations and minor wounds. And the first thing I want to say, I think probably everybody in this room already knows, is never use alcohol or hydrogen peroxide on injured tissue. Instead, clean with a dilute antiseptic solution. And here I really want to emphasize dilute. I don't know if it's the same in humans, but I find that a lot of times people feel like more is better, so they use a fairly concentrated solution on an open wound, and that just damages the tissue. So that what I usually say to pet owners is use something with povidone iodine and mix it with water so that it's so thin that it looks like a weak tea. In other words, it's really almost entirely water. And that's really the concentration that you want. That concentration will not damage the tissues as you clean the tissues. And then pat dry, obviously, don't rub. If you have it available, any kind of antibiotic ointment that you might have is fine. Not in the long term, because human products generally contain zinc, which is toxic if ingested in significant amounts in animals. People, we don't lick our wounds, so not a concern. But veterinary products that are antibiotic ointments don't contain zinc. Of course, in that just first response situation, use what you've got. And then you're going to do your typical layers of a bandage, which is starting with a non-adherent layer like a telfa, gauze pads, stretch gauze to wrap, and then covering that. We usually use a product called Vet Wrap, and now there's a lot of generic equivalents. I've got those with me. And then white tape. And really the two biggest differences, I'd say, between bandaging humans and bandaging small animals would be that, first of all, we don't wrap as tightly. It's a little easier to occlude venous return on a limb, and we wind up with a swollen paw. And the second is keeping the damn thing in place. Because fur is slippery. And as a result, you put this lovely bandage on a leg, and you know, in a few minutes, it's down here. And there's your wound, right? So we use a lot of white tape, and you have got to just aggressively tape your bandaging material to the fur as your last step in bandaging. In treating more significant wounds, major wounds, these I'm going to say don't clean it. Not unless you can reach a veterinarian and get that consultation, you know, in the moment that you're treating the animal. But the problem with cleaning a deep wound is that you're going to drive bacteria further into the wound. You just are. There's no getting away from it. It's much better to get it into the vet and let them do the cleaning. But what you do want to do is apply a wet compress. You can wet, again, with your dilute antiseptic solution, or even just plain water, whatever you've got available. Because, of course, your goal is to keep the tissues viable so that there's less debriding needed at you know, the definitive repair at the veterinary hospital. So a nice wet compress and then dry wrap. So basically you're kind of doing a wet to dry bandage in these cases, and then you're bandaging with your dry layers and then applying pressure to control bleeding. And that should hold things together well enough for you to get to the veterinary hospital.
Can you use hemostatic agents?
Use what?
Can you use hemostatic agents?
Like quick clot.
Like quick clot, or is that okay to use in veterinary situations?
We
Does it
don't,
even work?
we don't routinely. We use them in surgery. We do use clotting materials, but
Were they specifically formulated for veterinary use, or would the human
No,
version work as well?
yeah, I'm not acquainted with the human version, so I can't say.
I'm just
You know what? Little aside here, pharmaceutical industry being what it is, you could probably get your 1 unit of it for $350, and I can get it for 35 cents. And the markets are totally different. It will be the same product. It'll be a different color. It'll be different packaging, but So it goes. Veterinary products, anyway, things that are licensed for use in animals meet the same FDA standards as human products. Which is a handy thing to know.
Safe for use on humans and animals, quick clap.
Oh,
That's
really?
what
Yeah, that's
government's
great.
about.
Excellent. So you could. You
So
could.
the people on Zoom can't hear the questions, so if you could repeat the question so they can know what's going on.
Oh, okay. Yeah, I'll do that. Thanks. Thanks for pointing that out. So let's go a little deeper. If that wound is so severe that the real issue is bleeding, profound bleeding. In this case, again, a little difference that's pretty obvious between animals and humans is you can't get them to hold a limb over their head. Like the hand you just sutured up and you have the patient leave like this. You can't do that with the animals. So the best that we can do is at least get the head and the heart level with wherever the wound is. So if you can get that animal down and into lateral recumbency, that's your best bet in terms of having gravity not make the problem worse. And then applying direct pressure, obviously. Tourniquets in animals are difficult. They tend not to work so well, so we tend to do just a lot of direct pressure. And if it's a limb and we can access, we will also do pressure in the inguinal and axillary areas to just try to occlude arteries from there. But mostly it's going to be about a pressure wrap. If you've got an animal that's bleeding a whole lot, you're going to, of course, put on some clean cloth or clean gauze, whatever you've got handy. Those are going to get soaked. And a pet owner especially, you guys probably not so much, but a typical pet owner is going to take that off and put a fresh one on. What's wrong with that idea?
You just disrupted the clock.
Exactly. So you don't want to disrupt clot formation. So instead, what you're going to do is, of course, add layers on. Just keep adding layers on as needed so that you can have a dry surface on the outside that you're pressing on to try to control the bleeding that way. When you do put a pressure wrap on, and I'm really going to talk a lot about limbs because that's where so many of the injuries occur, you're going to need to put some pressure on it, of course, to control the bleeding if it's a significant wound. But if you put too much pressure on it, you will have a situation where the paw swells up because you're really occluding venous return, but you're not occluding arterial flow. And in dogs and cats, the classic sign, especially in dogs, is that their paw separates like this. Called it a Vulcan greeting. That's classic. Don't know why it doesn't do that. It does that. So watch for that. Now, if you bandage the animal because it's going to be a couple of hours before it can get veterinary care, that's fine. You need that pressure on the bandage, that's fine. But if it were a situation where you're at home and it's going to be overnight and so on, you really don't want to have that occurring. You don't want to have that much impairment to blood flow in the paw. And also, the skin on the paw is really tight. And as that skin stretches from swelling, that is super painful. So if you can find a way to avoid this with pressure on your bandage, that would be the best. Of course, if the blood loss is severe enough, an animal could go into shock or could go into cardiopulmonary arrest. And in that case, you're going to initiate CPR, which I'll talk about a little later. Lastly, in the way of injuries is fractures. And if you encounter an animal with a closed fracture, you just want to stabilize it in whatever position it's in, no matter what conformation you're seeing, and that, again, is going to be a limb. Just stabilize it in that position until you can get veterinary care. An open fracture, where you have exposed tissue and exposed bone. In these cases, it's even more important than what I said about major wounds to not clean, because you will drive bacteria farther into the wound, and in this case, you might drive it into bone. And you know that that's going to lead to osteomyelitis, which is really much more difficult to clear than soft tissue infections. So you don't want to clean, you just want to cover it with a moist cloth again and wrap and get them monitor for shock, because these animals are so injured that they can go into shock, and get to a veterinarian. I know I sound like a broken record, don't I? Get to the vet, get to the vet. But it is typically the follow-up that you're going to need to do. The next thing is eye injuries. And with eye injuries, what you might see, of course, is, a squint, open the eye, and you might see bleeding. Or it might be a different kind of injury entirely, where you have either a pronounced, protrusion of the globe or a sinking in of the globe. And the best way to identify that on animals is to get the skyline view. Look down from the top of the head. Because, I don't know if does that work in people? Yeah, okay. Because I think a lot of us have enough brow, though, overhanging, so it's harder. But you see whether one eye is more prominent or one eye is more sunken than the other, and that will be indicative, I don't know what that was, be indicative of changes in intraocular pressure. Any kind of eye injury, apply a neutral eye lubricant ointment if you can get a hold of that. Or if you need to, an antibiotic ointment. Just make sure you don't use an ointment that has hydrocortisone or any other steroid in it, because if there's a corneal scratch, then of course you don't want to have that. But any kind of lubricant that you can put on the eye is going to be soothing. And the other thing that's soothing is to get the eye to stop moving around. So, you know, if your eye really hurts, if anyone here's ever had an eye injury, you know that even just turning your eyes, moving your eyes is uncomfortable. And it's the same with an animal. So if you cover one eye, the injured eye, you do nothing because they're still going to look around with the other eye. So what you do is you cover both eyes with a nice head wrap around both eyes. And surprisingly, animals really tolerate that just fine. It's crazy, but they don't panic the way I would if you covered my eyes. And in some animals, it's even quite calming. Like, for instance, years ago, was regulating a diabetic cat, and I was having to draw blood samples all the time, including after hours when I didn't have a tech handy. And I put on the cat a little muzzle that just covered the whole face and it covered the eyes. And then single-handedly, I could just hold up the jugular and draw my blood sample. It was great. Or the other thing that I used to do, covering the eyes, that would just be so much fun, is rabbits. Rabbits are totally pixelated if you cover their eyes. And of course, they are becoming more common as pets, so it's handy to know this. And so I used to cover their whole head with a stockinette, put them on the x-ray table in whatever position I wanted, and they'd just lie there. And I'd go and I'd take my picture and I'd go take the stockinette off. It was just a blast. It was just because it's so crazy that would work, but it does work. So yeah, so cover the eyes. That's going to be a great way to relieve pain. Yes.
Contact lens saline, the unadulterated stuff, not with any.
Yeah, definitely. That's good if you think there's any kind of irritant in the eye. Absolutely lavage the eye with saline. In fact, even, just contact lens solution, anything that's handy. I mentioned the ointment as just something that you can leave in that's comforting. It's going to, really reduce the pain in the eye. Yeah.
What about tetracaine drops?
Tetracaine drops would be okay. I'm sorry, I forgot to repeat the question. It was about whether or not to use saline in the eye. And I was saying, yes, it's fine. And yeah, tetracaine drops would be fine. Yeah. Ear injuries, big, like that guy right there. And as soon as their ear is injured, what they're going to do is they're going to shake their head. And just the same as with the eye injuries, where a dog or a cat with an eye injury immediately makes it worse by pawing their eye. A dog will make it worse by shaking their head, and as soon as they do that very much, they're going to slap that ear against a counter or a table leg or something and rupture blood vessels in the ear, and then you've got an oral hematoma. Really painful. It takes a long time to resolve. So the same as with eye injuries, and I didn't really stay on that with eye injuries, but with eye injuries, it's a good idea to do what you can to prevent further damage. You want to do the same with ear injuries. Now, with eye injuries, the best way to prevent further damage is to put on an e-collar, a lampshade collar. Are you familiar with those? Elizabethan collar, big plastic cone on their head. Because that will prevent them from being able to rub their eye or rub their eye onto surfaces, like plowing their foot along their eye along the rug. In fact, it's a really inexpensive thing to have on hand, so that I like to have at my house an e-collar that's the right size for each of my animals. And it's a few dollars for each one of those e-collars, and it's just a great lifesaver if something happens at night and I need to just protect the injury until I can do something more definitive to take care of it. So the dogs that are shaking their head, cats are a little more sensible about this, and besides, their ear flaps are smaller. But dogs will shake their head and damage their ear further. The best thing that you can do to kind of prevent that process from getting worse is to wrap all the way around their head, cover one or both ears, and just you're snugging the ear flap against the head. That will not only prevent further injury, but the same as the covering the eyes with an eye injury, it really is more comfortable. You bring them a lot of relief just with that simple action, until they can get in and get that wound sutured up. I want to move on to internal bleeding, and The symptoms that you will see are probably mostly similar to what you would see in people, but how you assess might be a little bit differently. They're going to be pale, they're going to be weak, they're going to be ataxic, they're going to be confused. We always check for internal bleeding in the abdomen, and I don't know how that's done in people. What we do on dogs and cats, though, is first of all, you might or might not see a swollen abdomen, kind of developing a pot belly or a beer belly abdomen. It'd be classic that there's fluid in the belly, whether it's blood or anything else. But we put a hand on one side and percuss on the other, tap on the other side, and you'll feel a fluid wave come back and hit the hand that's on the side like this. And that is absolutely diagnostic for either really severe ascites or hemorrhage in the abdomen, or if it's a hit by car. A lot of times the worst injury in a hit by car is a ruptured bladder. And so if the abdomen has filled with urine, you're going to feel that way, yes.
My question is, in terms of looking at an animal's coloring, are you looking at their gums? Are you looking at like paw pads in order to determine what?
Where to look to identify the animal's covering? The gums. The gums show you their color. Yeah, so you're going to look at gums, and you're going to do capillary refill time on the gums too. See if you can blanch the gum and have it refill in the normal time, which is 1 to 2 seconds. So that is how you identify internal bleeding. And the same as I said with really severe trauma, the animal might go into shock, might even go into cardiopulmonary arrest, and in that case you're going to initiate CPR. Burn injuries. You're probably think first of situations where the animal's in a fire, and that can happen, of course, and I'm going to talk about the big problem with that, which is smoke inhalation, in a couple of minutes. But actually, the most common burn injuries that we see in animals are on their foot pads. And the reason for that is pretty ridiculous. It's because they smell that hamburger on the grill or on the stovetop, and they want it. And they jump up on the stove or the grill, they burn their foot, and they jump off. And now they've got kind of a scorched pad. Although I will never forget one cat that I knew that jumped on the grill and wanted that hot dog so badly that he stayed long enough to grab it, and he jumped off with it in his mouth. I'm like, oh my God, that had to hurt. But yeah, so foot pad injuries are where you usually see burns. There's not a great deal you can do about that, excepting that, of course, if it's been just immediate, cooling will help. Moist cooling compresses will help. And in general, if there's a more significant burn, and it's not just the foot pads, it's not due to hot dogs and hamburgers, but a house fire situation or a car fire situation, if that burn covers less than 15% of the body, then also if it's just happened, like within the last 15-20 minutes, cool compresses will be helpful. Don't overshoot. You do not ice tissue like that because you will cause a lot of damage doing that. But cooling it will really reduce the extent of damage if you're able to intervene really quickly. If it's involving a much larger area of the body, then the bigger injuries, the bigger concerns are shock and hypothermia. And so in those cases, what you're wanting to do is cover the animal, keep it warm and dry and calm as you can, and get it to the vet. Oh yeah, so next I guess I am going to do smoke inhalation, is that right? Yeah. Next is smoke inhalation. So how many of you would be responding to a fire in your either work or volunteer work? Yeah, quite a few. Okay. So then you're probably already trained in what are the main problems with smoke inhalation, right? Carbon monoxide. Why? Anybody know why? Because hemoglobin binds to carbon monoxide.
Has a higher affinity.
Way higher, like hundreds of times higher affinity than for oxygen. And so as a result, all the oxygen gets displaced off of the red blood cells, and that's why that's poisonous. Yes?
Are there actually high-end pulse oximeters that discriminate between the two? Because
Yeah.
yeah.
Well, did-
Rad 57s they're called, I think, and then usually like most commercial cardiac monitors have SpO2 and SpCO. Our monitors do.
Oh, that's pretty good. We don't.
I don't know where you put that on a dog or a cat, but
It probably works just fine. I've never seen one
maybe on
like
the
this.
ears.
Yeah.
Assume that they do and put them on oxygen.
Yeah. Yeah, that's the benefit. You can chew with those big brain screws.
Second problem with smoke inhalation, besides carbon monoxide. I know you know this.
Hydrogen cyanide poisoning.
Hydrogen cyanide. So why is that toxic?
God, you make me think.
That's a harder one, isn't it?
No, it's like a chemical. Chemical hypoxia, basically. I don't think it allows oxygen to bind.
You're
I
close.
can't remember.
He's close.
Specific pathophysiology.
It is because it gets into the cells and it blocks aerobic metabolism.
That's okay. There we go.
Through, God, biochem, blocks oxidative phosphorylation and something to do with ATP, and I don't remember it all. But so as a result of doing that though, the blood becomes 100%, becomes super saturated with oxygen, which is why you see what? The classic sign, cherry red mucous membranes, right?
That doesn't matter.
Isn't it called like histotoxic hypoxia or something?
So yeah, so those are the two biggies, carbon monoxide and hydrogen cyanide, but also the particles that are in smoke go down into the alveoli and cause a lot of damage there. Which is really a big part of the reason that these animals are among the ones where I would say it looks fine, it stopped coughing, it's not panicked anymore, and you think everything's okay, and it's not, because that damage deep in the lungs is just beginning, and that animal will progress to pulmonary edema. And then, of course, last of all, there is thermal injury, although that really only involves the upper airway.
Are the carbon monoxide levels similar to humans, do you know? Like the cutoffs? Is it basically there should be no carbon monoxide in anything over like 10 or 20 you're worried
Yes,
about?
yeah, it would be comparable levels, yeah,
Okay.
yeah. So what do? All that you really can do in that situation is deliver 100% oxygen in whatever way you can. Maybe it's a nasal cannula that you can put near their nostrils. Maybe you can take a face mask and stuff it with enough gauze around it so that it sits on the muzzle. Anything that you can do to get oxygen into them is just really the main thing to do as you transport them to the veterinarian.
Sorry, one more question. So
Sure.
Marie had said that they had some kits. Does anybody else have animal? Do you guys actually have?
We have them on our fire truck.
Yeah, we have them on our, we have them on the ambulance.
Yay.
One of the local vet offices donated them years ago.
Oh, really? So they're old.
They probably should be replaced, but.
Yeah. Oh, that's phenomenal.
Yeah,
So then I'm going to move on to the next subject, which is chemical injury. And most chemical injuries really look like a burn. Here's where history can make a difference. I've had cases come to me where I wouldn't have known which it was without some history, or sometimes it will be the distribution on the body that tells me, no, that's chemical. But in general, as far as the tissue damage, they really look the same. If the chemical is a dry chemical, and it might be something like pool chemicals, chlorine granules and things like that, whatever you do, don't wet it, brush it off, and then after you've gotten as much of it off as you can, then apply water to just soak and soak and soak to get off of any residue. And of course, that's what you're going to do with a liquid poison as well, a burn, chemical burn. You probably know this. You don't want to neutralize it on the animal, right? Do you know why?
Can cause overheating to the area.
Sorry?
Can cause a heat injury to the area.
Exactly. So when you put together an acid and an alkali, that reaction of reaching a neutral pH generates a lot of heat. So then you're going to have a thermal burn, a chemical thermal burn on the animal. So you just get it off, rinse copiously with lukewarm water. And if it's in the eye, rinse with water, contact lens solution, saline solution, lactated ringers, just anything. Just for a long, long time. The eye is going to wind up pretty irritated from all that rinsing, but you've got to get all of the chemical out. Shock can be a consequence of, oh yeah, go ahead.
Before you move on, does poison control cover animals as well?
Does what?
Poison control. So if we're looking, if we identify the chemical,
There's a separate animal poison control, and that's another number actually that's great to have with you.
Is it free?
Yeah. Well, you can consult them and get some information from them. A pet owner calling saying my dog just ate such and such, there would be typically a fee, but no, you can definitely get in an emergency situation. You can get
The
free.
ASPCA has a free line.
Yeah.
But
What's the phone number that you're, do you know it off?
I don't, I'm sorry, I don't know it offhand, yeah.
It's a Google machine.
What's that? I'm gonna get my Google.
Now, assumably a dog would, or a cat would be in a lot of pain for this. We carry several pain management medications that, should a needle happen to fall,
Don't use them.
no?
I'm sorry, but pain meds, that's one of the things where it's really different between humans and animals. And that's why if you have ever gone to the vet with an animal that's, you get prescribed pain meds, it's going to be something different from what you're used to taking yourself. Lots of NSAIDs, veterinary NSAIDs, but for instance, if you give a cat a single Tylenol, you can kill that cat. If you give a dog a few ibuprofen tablets, it can hemorrhage, gastric hemorrhage. Just really different physiology comes into play with pain meds. But we do use a lot of narcotic pain meds.
Buffered aspirin is safe though. Yeah. Buffered aspirin is safe.
Buffered aspirin, yeah, infrequently, like in a jam. Yeah, but you'd want to switch from that as soon as you could to a veterinary NSAID.
So on the narcotic end of things,
We definitely use a lot of narcotics. Dosages are going to be different. But again, if you can get a hold of a vet and you've got that drug, you've got buprenorphine or butorphanol or anything, you can probably get a dosage from your vet if you can get a hold of them and administer that.
Then you gotta figure out how you're gonna account for that medication, but that's a different thing.
Open wide.
for someone else to worry about.
Yeah, Dr. Stein said it. That's how I explain all of my deeds. I'm trying to.
You know I would probably say yes.
Yeah.
We only need your okay.
You should totally second that.
I don't know if you're gonna get to this, and, but they can you, if you feel like a dog or a cat needs fluids, even if they can't get an IV in, can they do the sub-Q? Like, is there any way to infuse sub-Q?
We do sub-Q all the time.
So this is
For
something these
fluids,
guys
yeah,
could do for fluids. They
I would, you
Yeah.
know, especially since you're not using a drug. You're going to use sterile saline, normal saline, or lactated ringers, or something like that, or half and half, half saline, half glucose. Any of those in an emergency situation, given sub-Q, absolutely.
For
Yeah.
poisonous ingestion, can we use activated charcoal?
I'd rather have the vet do that,
Okay.
but that is what we do.
Just in case their airway becomes compromised or something, or?
Yeah, I think, yeah.
Okay.
I would try to not go quite that step in emergency care. I would
Hydrogen
try-
peroxide?
Besides, it's not a matter of minutes.
Oh, to induce,
If you're thinking of giving activated charcoal, it's not a matter of minutes, it's got to be given that moment. You know what I mean? I'd say you have time to get to an emergency facility for that.
Like 45 minutes to the closest one around here, I think.
Yeah.
Yeah, hydrogen peroxide, I've heard that too.
Yeah.
Yeah, for inducing vomiting.
Oh,
Yeah.
Hydrogen
it can
peroxide
help for
induces
us.
vomiting, but you want to be sure you're not causing something to be worse instead of better by inducing vomiting.
You talking about like vomiting up a caustic substance or something?
Exactly,
Like
exactly, right.
Is that what you guys use? Hydrogen peroxide?
No, once they come to the hospital, we do a
Apomorphine.
medication that's absorbed through the eye or apomorphine.
Yeah.
We've shied away from that a little bit more because apparently long-term exposure to humans is not very good, but
They did human studies,
yeah,
this is animal studies.
yeah.
Was there
Just a
another
lot more
question
critical.
somewhere? No? We're all set? Okay, good. So yeah, I think I was starting to talk about shock, and that the signs that you would see would be probably pretty much similar to people. Pale gums, heart rate might be increased or decreased, but in either case, it's thready pulses. And again, I'm going to show you how to check a pulse on a dog or a cat. And basically, it's just a case of keeping them warm, seeking veterinary care. Not a lot more I can say about shock.
I forgot to ask a question. When you previously, before we were talking about fractures, if the animal will let you, why specifically do you suggest not to splint? Like if we have.
You can splint it in the position it's in,
Right. Yeah.
but whatever you do, don't try to change the position of it.
No reducing it, no altering the position,
That's-
but like
that-
splinting in the position you find it is fine.
That's just a part of stabilizing. When I said stabilize
Okay.
it, is anyway, absolutely, sure,
Okay.
sure, yeah. Stings, bee stings, wasp stings. If an animal gets just one or two stings, it's probably not a big deal. They usually get them on their face if it's just one or two stings, because they've just put their nose where they shouldn't have. And it can look pretty dramatic, because their face kind of swells up. And If you were old like me, you'd recognize what it means to say they have a Jimmy Durante nose. That's what we used to always say. They get this great big bulbous nose. The other way that it can be of concern is sometimes it's a dog running through a field and they go right over a ground nest and they get 50 or 60 stings on their belly. That's going to be pretty severe histamine release from that. I shouldn't probably tell you this, but when I was in vet school, a professor said to the class, and he said this kind of tongue in cheek, but he said, if an animal gets a bee sting, and their face swells up like that, and that client calls your hospital, you want to get them in right away. Get them in right away. Give them an IM injection of diphenhydramine, Benadryl, and it's great because within like 15 minutes that swelling has gone down. The owner is going to be happy and they'll go home. Well, so why is it an emergency to get them in that fast? It's because if you don't get them in, 2 hours later, the swelling has gone down. And you missed your chance to look like a hero. So point being, of course, a bee sting isn't really all that big a deal, unless, as I said, unless it's a lot of stings. And also, because animals don't go into anaphylactic reactions to bee stings as much as people, I'm not really worried about that, unless it is a whole lot of stings, like I said, on the belly. When they've run across the field and gotten a whole lot of stings on their belly, then I'm going to be kind of monitoring heart rate and respiratory rate to make sure that they're stable.
Is there airway edema, any, like, not complete systematic anaphylaxis, but with an excessive amount of stings on the face where you could have airway compromise?
I have not seen it happen. It seems to me that it's more of just a totally localized reaction on the muzzle. Yeah, not really going that far in to affect the airway. Yes?
They get epi for anaphylaxis like everybody else?
Yes, if necessary, although I've done just IV by Benadryl
Yeah.
with complete success.
For anaphylaxis?
Yeah, IV,
Yeah.
but yeah. Mm-hmm.
And just confirm, it's half mg per pound, not kg?
Right.
Per pound.
What would it be in people? How much would a person take of Benadryl orally?
Like, I guess it's almost,
It's 20,
No,
half
orally,
to
like,
25
it's
to
50
50s,
milligrams, so-
and yeah, it started 50
Yeah.
probably.
so that's probably half meg, but we do it by kilograms.
Yeah, we do often. It's such a mishmash right now, I don't know if it's... Of course, the treatment depends on what the animal took in. And so what you want to do is get whatever information you can on that, and usually it's getting the package. Maybe you can get a hold of a vet and text a photo of the package to the vet. If an animal vomits, take a picture of that and send it to the vet, because we're used to looking at vomit and it's pretty informative, so as you know. So that kind of information is very, very useful. And there is animal poison control, as we talked about, and also as talked about, do not induce vomiting unless you've reached a vet and they say, yes, give this much hydrogen peroxide per PO, and that would be safe and resolve the problem, hopefully. But otherwise, do not induce vomiting. It's quite possibly doing a lot of damage to the esophagus in doing that. I promised I would tell you how to assess hydration status, and so let's talk about that a little bit, which is making me thirsty. I always get thirsty at this point.
Quick question, so don't induce vomiting if they eat chocolate.
Yeah, you'd have them vomit for chocolate.
Unless it's Hershey's, because there's not a lot of chocolate in Hershey's. But
I know, yeah, see, the cheap chocolates aren't so bad, right? Because they're just all sugar and not that much true cocoa. But dogs are definitely more toxic, more sensitive to all the, theobromine, caffeine, all of those stimulants are definitely more of an impact on animals than humans. Anyway, dehydration. So mild dehydration, the gums are going to be a little bit tacky. I should back up a little. It's in normal hydration. You touch the gums and your finger comes off moist because their gums are just always moist normally. If you touch the gums and it's feeling a little tiny bit sticky, a little bit tacky, that animal is maybe 3% dehydrated, mildly dehydrated. If instead the gums are actually dry, then you've got an animal that has more significant dehydration, maybe 5 to 8% moderate dehydration. As dehydration progresses further, the eyes will become dull, become sunken, and also you would check with taking a pinch of skin. And do most of you know how to do that in a dog, checking for hydration? A lot of pet owners will know that. What it is that you take a pinch of skin right over the back, and if they're normally hydrated, as this guy is, it disappears right away.
So it's almost like normal skin turgor on a human.
Yeah, but you know how their skin is so much looser than ours.
Yeah.
So I don't know how much dehydration it takes in a human to cause this, but if an animal is moderately dehydrated, that pinch is going to just gradually go down like that. And of course, if they're severely dehydrated, that pinch of skin is practically just going to stay there. It's going to really take a lot of it down. I'm guessing that it's a little different in people. It probably takes more dehydration in a person to cause that much change in skin turgor. I don't know for sure, but I think that because their skin is so loose and has such great elasticity, that's a great way to check for the degree of dehydration. When they get to the point where they're actually starting to seem shocky, you know, with a weak pulse, rapid pulse, then you know that they're pretty profoundly dehydrated, and that's becoming a life-threatening situation. So to rehydrate, the rule of thumb is the more dehydrated they are, the more time you should take and the more gradually you should rehydrate. So, for instance, if an animal is really just mildly dehydrated, you can give them free access to water and they will self-regulate. They'll do fine with that. But if they're moderately dehydrated, then you instead should just, you know, put some water down every half hour, 45 minutes, and let them drink some, but not all that they want, and take it away. And if they are really more severely dehydrated, but not like at that life-threatening point, then it's going to be just a little tiny bit of water every few hours, which I'll tell you as a pet owner will drive you crazy because you're dying to rehydrate them. But you must do it gradually like that in order to safely rehydrate that animal.
Why is that?
Risk of, well, the first thing that they will tend to do is drink too much and vomit it immediately. And so then you've just made the problem worse. And the other is, of course, over-ingestion of water and cerebral edema. So opposite extreme of that is drowning. And the way that this usually happens is you'll have a couple of dogs racing around in the yard, and one of them makes the turn, and the other one doesn't quite make the turn, and they go straight into the swimming pool. They don't know where the steps are, and they can't get over that lip on the edge. And so you have an animal thrashing around in the pool. So hopefully this is identified pretty quickly. You get them out, but if they're actually unconscious because they've been in that long, you're going to do a lot of what you would do in a person, but just a little different because of their physiology. You've got to put them on their side, their head is hanging down, maybe the pool is still right there, and you hang them over the pool, and just press on their entire chest to try to expel whatever you can. Oh, and this guy just advanced my slides on me. Bad tiger! Anyway, you want to open up the airway by pulling the tongue forward. That really does open up the throat quite a bit. Press on the whole side like that, and then keep the animal warm as you get it to veterinary care. Of course, if they've been in the water long enough, they might have gone into arrest, and you're going to need to perform CPR. Hypothermia might accompany, oh yeah, go ahead.
Just one question on dehydration.
Yeah.
Can you give, how much sub-Q do you give per pound?
Okay, if you can rehydrate sub-Q, that's fantastic. I would still try to be at the same time rehydrating orally. But sub-Q, so you know, a maintenance dose is about 30 mils per pound per day, right? So, and again, I don't know what it is in people, but that's about what we'd use in a dog or cat. And if I were rehydrating, say,
30 mLs per pound per day
yeah,
of rehydration.
So I would double or triple that right off the bat. So if
For
I had
severe dehydration?
yeah, moderate even. You know,
Okay.
I would. Just you've got to divide sites because you can't put a whole huge pocket in one place. But
Right.
for a typical, say I have a 10-pound cat, I would give it 600 cc's, 750 cc's sub-Q, divided into 2 or 3 sites.
How quickly does that absorb?
Fast.
Yeah.
But again, the more dehydrated they are, the longer it's going to take to resorb. And so you put it in, you know, up dorsally, and you're going to wind up with it spreading and then making a pouch down eventually, and then that will get absorbed. But along the way, a lot will get absorbed. And yeah, that's really, if you have access to doing that, that's great.
So along the spine?
I just go a little off the midline.
Okay.
Yeah, so that I know it's going to go down one side, and then I can just go off the midline on the other side and let it go down that side. Yeah.
Like underneath, like kind of like the scruff of the neck.
Yeah, exactly. Which is also a good place because this is the area where their skin is less sensitive than elsewhere. You think of how moms pick up their pups, right? So if you go farther back, which you might have to if you've given a couple of sites up here, now you go back to here, so you'll find the skin's a little bit more sensitive. But yeah, start up right around the nape of the neck, perfect spot to hydrate. Okay, hypothermia. If the animal is wet, just gently pat them dry. Don't rub. I know with people will buff to warm up, but animals are another one of those differences. Their skin is actually very thin, and so their fur is a major component of their protective barrier from the environment. And so, especially if their fur is wet and you go and buff, you're going to cause a lot of damage to the skin. So just pat dry. Position them laterally because you're trying to get them into as safe a position as you can, and then do you carry emergency blankets, like those foil emergency? Yeah, wrap them in that. Anything you can do to keep them insulated and warm as possible till you get them to the vet. And again, of course, as with everything else that's really severe, they can go into arrest and you would be performing CPR. But much more common than hypothermia is hyperthermia. And what's the most common cause of that?
Cars. Leaving them in a locked car.
Leaving them in a hot car. 65 degrees out and I left the windows open that much, it should be fine, but no, in the car it's all of a sudden it's 105, 110 degrees. That animal cannot thermoregulate in that sudden heat. So if the temperature is over 105 typically, we would call that heat stroke. Below that it's a fever. Normal temperature usually in a dog or cat around 102.5 is the limit. And they really run to range. It always kind of surprises me when we say to people like right on to the 10th degree, that's normal. Because we'll say anywhere from like 100 or 100.5 to 102.5. If they're in my exam room, 103 is okay because they're stressed out. But it's quite a range. And it's only when you get up to over about 105 that you would really say, this is not just a fever, this is really heat stroke. Now, treatment of heat stroke is something that has changed a lot over the years. When I was in school, we were taught to cool the animal as fast and as aggressive as you can. Give them ice water baths, give them ice water enemas, just especially concentrate on the head because you're trying to cool the brain. And not long after I got out, I actually did that on a patient, and I got actually commended by my emergency medicine professor for how I treated the animal. But another year later, I was at a conference and they said, whatever you do, don't do that. Because you throw the animal into DIC, which is in fact what happened to my animal, my patient. So you don't cool aggressively. And then they went to the opposite extreme. This, just very gently, just pat alcohol pads onto the foot pads, just carefully cool them down. Of course, that doesn't work. That's not fast enough. So now we're in the middle road. Cool them down. Don't do it too fast, don't do it too aggressively, but cool them down. And so gradually cool them down, but their whole body. I would put wet towels on their body, put a fan on them, but no ice water. And stop a little before they're all the way down to normal, because their body is then going to be in corrective mode and it's going to continue to cool down. So we stop at around 103 or 103.5 and let them go from there.
What's DIC?
Sorry, disseminated intravascular coagulopathy. And what that is all these micro blood clots form throughout the bloodstream. And it's fatal if untreated.
Thank you.
Mm-hmm.
May I ask a question going back a little bit for the poison and drug exposure?
Yeah.
Opiates
Yeah.
and Narcan. Dogs can receive Narcan same as humans, correct?
I'm not acquainted with that. So I wouldn't know about dosage and so on. Mechanism of action, it should be right. But I couldn't begin to tell you what a dosage would be. Let's try.
Yeah, say do it.
Will the dog tell us to get the hell out of their house after they recover?
0.4 milligrams per kilogram, apparently Dr. Google says.
Yeah.
Good enough.
Yeah.
I want to talk to you about bloat. And this is a really important one, and this hits home for me because I'll tell you about a dog of mine. How many of you have a deep-chested dog, like a German Shepherd, Greyhound, Collie, any other deep-chested Sighthound, Golden Retriever? Yeah. These dogs, do you know about bloat?
Yep.
Mhm.
Okay. No. Some of you do, some of you don't. Okay, so it's really good that some of you know about it. What it is that a dog, and this happens in dogs only, so it's not a cat problem, but they will have their stomach suddenly fill with air and really distend enormously, filling the whole abdomen, compressing against the diaphragm, and starting to occlude its own blood supply because of the distortion of this configuration of the belly. To make things even worse, it will progress to a twisting of the stomach. And then we have what we call GDV, gastric dilatation and volvulus, at which point it has totally occluded its blood supply, and the stomach itself will quickly become necrotic. So obviously, this is a very serious emergency. It's not an emergency you guys are going to be responding to, but it's an emergency that you might see as an owner. And the symptoms of it are that the animal will, of course, have abdominal pain. They'll be drooling, they'll be gagging, they might be trying to retch. They're going to abduct their elbows, trying to just get more space in their body, because they're, again, the stomach is compressing upward on the diaphragm. And the cardinal sign, I hardly ever say any disease or condition has a cardinal sign, but this one I will. The cardinal sign of bloat is non-productive retching. So your animal is trying to vomit, tries to vomit, and then vomits on your favorite rug. I want you to thank them. They just saved you $5,000, and everything's going to be okay other than the rug. However, they vomit. If they don't vomit, then you might really indeed have a bloat on your hands. And the other thing that is really strange about dogs, and cats sometimes too, is that when they have a minor injury, they can act like a total prima donna about, oh my God, I'll never walk again because I had a broken toenail. But then sometimes, they have this massive, major injury or disease or condition, and they don't express it in a way that we recognize as humans. I've seen this more times with my own animals and with patients, and so it can really be confounding. In a way, I prefer animals that are really wimpy because then I know something's wrong. But so I was going to tell you there's an example with my own animal, and that was that I had a greyhound who I was just sitting working at the computer, and he kind of walked by and he stopped, and he retched a couple of times. But he acted like he was otherwise fine, and then just went and looked out the window, and I thought, well, you poor baby, you must have eaten something you shouldn't have out in the yard. But then he turned around and did the exact same thing again, twice retched. He's not drooling, he's not gagging, he's not doing anything else, he's not showing abdominal pain, but twice non-productive retching. Well, vets always think that our own animal is having whatever's the worst possible outcome. So it's a bloat, for sure, it's a bloat, right? So I whisked my dog into the car, started on my way to the emergency hospital, because of course it's the midnight on a weekend. I called ahead and said, I'm on my way with my dog, he's bloating. And, he loves car rides, and so he's sitting up in the front seat, he's looking around, and I'm thinking, I totally just overreacted here. This is ridiculous. And I suddenly remembered I never did let him out to pee before he got in the truck. I just threw him in the truck so fast. So I found a safe place and I pulled over and I took him out to go to the bathroom. And he didn't go to the bathroom. Twice non-productive retching. I realized, okay, this is it. So I went the rest of the way to the hospital. X-rays immediately showed his stomach was like this big, and he went into emergency surgery and he survived. But really, that's all it took for it to be a life-threatening condition. So all of you with deep-chested dogs, please be paranoid about bloat.
How quickly do
If
you
it goes to
intervene?
volvulus, it's going to be becoming necrotic within an hour. So it's life-threatening in a pretty short time.
There is a preventative surgery that you can advocate for your veterinarian to do when they do a spay or neuter, called a prophylactic gastropexy, where they actually pexy the stomach to the abdominal wall.
One of our guys is a Great Dane and had that done.
Good.
Highly
Yeah.
recommend.
Yeah. Any female. In males, of course, you're not really going into the abdominal cavity otherwise. So, but certainly every female, since you're going to be right there, it makes total sense to pexy at the same time. Yeah.
What causes bloat?
It initially was thought to always be caused by a large meal and then immediate exercise. And it's true that can cause it. And it was originally thought it occurred only in German Shepherds. It was first identified in military dogs. And they would feed the dog a big meal, and they might even back then been feeding it once a day. It gets a big meal, then it goes for a workout, and it would bloat. And so it was initially thought to be just a German Shepherd problem. and just exercise after eating. But it's since been shown, and I've seen it myself plenty of times, to be anything that causes stress that can cause the stomach to fill up. Like I had one client who came in, she had a German Shepherd, but she'd been away on a trip for a couple of days and you know, had someone taking care of her dog. She got home, the dog was all excited to see her, and then went to a big drink of water, like a big drink of water, and then acted like he had abdominal pain. And she brought him into me right away, thank God, because he bloated. So it's kind of weird, you know, it just can take excitement and stress. It doesn't have to be associated with when they ate. Although I certainly do avoid, you know, vigorous exercise right after a big meal.
Me too.
Which is a good idea anyway, right? I don't like it myself. Moving on, I'm sorry, this is really taking quite a bit of your time. Almost done.
We're asking
This is great.
It's okay?
Yeah, this is great.
Electrocution. And this is usually an animal chewing a wire. If things go really badly, they actually could be clamped on because they're muscle spasms and they can't let go. And the obvious thing to remember is that you don't just quick pull that animal away from the source because current can travel through them to you, right? So instead what you want to do is get rid of the source safely, which is, most of the time it's something that's plugged in. And so you just take a broom or anything, this non-conductive material, and you know, swing it by to unplug the wire. And then what you will typically find is oral burns, especially on the lips, but also on the tongue and the roof of the mouth if they've really chomped down, or especially if it's a big wire, like maybe it was an outdoor extension cord, that's going to be pretty big diameter. It causes a lot of damage across the mouth. If it's bad enough, they could arrest, and you're going to be applying CPR. But short of that, you will have burn injuries. And obviously, these are not areas that you can bandage or even get medication to stay on. So just cool water to cool the wound and relieve pain. And remember that this is, again, a pulmonary edema situation, because that's another injury that will be a silent killer, and they need to be monitored over the next couple of days for pulmonary edema. Seizures in animals are pretty common. We do see a lot of epileptic dogs and cats. When an animal is seizuring, you know, they're going to be thrashing around, and the first thing you want to do is try to move them away from obstacles so that they don't injure themselves further whacking into things. But then, the other thing that will happen that's kind of different when it's an animal situation is that other animals don't like this weird behavior they're suddenly seeing, and there is a tendency for them to respond by attacking the seizuring animal. So be aware of that. If you've got 2 or 3 dogs and one of them goes into a seizure, make sure that somehow the other dogs are not going to get access to the one that's seizuring and come in and attack. You don't have to worry about their mouth, swallowing their tongue, that kind of thing. So you don't need to get their mouth open, and there's no reason to get your hands anywhere near their mouth. Instead, just, you know, just, if you possibly can, record the start and finish times of the seizure, which is always, as a pet owner, hard to remember to do the first time. Once you've seen 1 or 2 seizures, you're more likely to be able to remember, oh yeah, I need to jot down what time did that start and what time did it finish, because that's going to, of course, determine how the veterinarian treats. Airway obstruction. They will be pawing at their mouth, gagging, drooling, trying to breathe, opening their mouth, opening their rib cage up by abducting their elbows, and avoiding lying down. They don't want to do anything that puts pressure on their chest. If it progresses far enough, their gums are actually starting to go from pale to bluish. And I want to advise you about cats. Cats never breathe through their mouth. If you think about it, you never see a cat, of course you never see a cat pant, and you just don't see them relax their mouth open. So really in a cat, that could be the only sign of an airway obstruction. It's just suddenly they are actually opening their mouth to breathe. The only other time I've seen a cat with an open mouth is when they've got a foreign body stuck in their mouth. That's really those 2 things. These are these are especially a case where the animal is going to tend to thrash around if you get near their mouth. So I would recommend that you use anything that you can to open their mouth without using your hands. So a loop of rope or a leash or anything to pry their mouth open and get their tongue forward, to open up their airway as much as you can. We often in the vet clinic situation use a roll of white tape as a mouth gag. If it's a big enough dog, that's a perfect mouth gag. And then you're going to look and see if you can see. You oftentimes will see what is it that's in there. And some people will advise that you should then sweep in, do a 2-finger sweep, and pull it out. Others will say that's a really bad idea because there's such a high risk that you're actually just going to push it farther down and now it's out of reach. So what I recommend doing is using hemostats, or at home even just needle nose pliers. Just reaching with that, because then you can grasp it. The only thing being to be really sure you don't grasp tissue, but they actually grasp the foreign body and pull it out that way. Failing that, a Heimlich maneuver, and not too different from a person, excepting you're probably doing it from the side, forcefully to try to expel it. Ideally not if it's a sharp object. If the animal is still getting air in, but there's an obstruction, partial obstruction there with something really sharp, preferably you can get them to a vet and get it removed that way, because of course expelling it that aggressively will cause a lot of tissue damage. Penetrating chest wounds. If a foreign body gets into the chest cavity and is still there, whatever you do, don't remove it. You probably do know that. You know that from people. Don't remove it, because at least hopefully it's making a seal so that they can still generate negative pressure in their chest cavity and breathe. So secure that foreign body in place as you get them to the vet. If the foreign body is out, then you need to make a seal. And so one more thing to have in your kit is a little bit of plastic if you can, a little bit of saran wrap. If not, use any plastic. I don't care if it's a food wrapper, I don't care how contaminated it is, get something plastic onto that hole. And then, because animals have fur, they're still going to have air getting into that hole. So you need to seal that plastic onto the hole. Use any fluid you can to wet the fur, and that will seal it. You know, and maybe they're bleeding a lot, and you could just slap the fur with blood and seal that on, and then overwrap it with tape to keep that in place, so that the animal can, again, they can still breathe because you're allowing them to maintain negative pressure intrathoracically. They will overheat quickly, so keeping them cool is important. Let's see. Okay, last subject, cardiopulmonary arrest. It's going to sound kind of silly to say make sure that they're really unconscious, but you know, sometimes animals do weird things, and they just, you know, something really bad has happened, and they just kind of decide they're just going to like have a little out-of-body experience. They're just not going to move. They're not going to be present at all. And you think that they're unconscious, and you go to do something, and they lunge at you because you startled them, and they come right back to life, and you get hurt. And back to rule 1, be safe. So just simply quickly make sure that they are still unconscious, doing something far from the mouth, tickle a toe, and then place them into lateral recumbency, extend head and neck. If it's a small animal, small dog or cat, you can just cradle their chest between your hands and do compressions like that. But if it's a larger animal, you will not generate enough force nor over enough area for that to work. So you would really just get them onto the floor, which probably is where they are anyway, lateral recumbency, both hands, compressions, okay? Most people in an emergency situation, they just get so amped up that they're going like this. And right, I mean, it's just, you can't help but do things too fast in that situation. And the problem with that being, of course, the heart hasn't got time to fill with blood between compressions, and so you're not getting any circulation whatsoever. So think of it as being less than twice a second, you know? And so, you know, yeah, I say in the handout 100 times per minute, but who can do that, right? So just think of it as a little less than 2 a second. Airway, you need to hold your mouth shut, and especially at the corners of the mouth, that's where when you start to blow into their nose, the air will come flopping out there. So hold them closed there, put your mouth over their nose and breathe in. And then, of course, just let go for them to passively exhale the air. As you do that, you're going to get air into the stomach. And so you'll, after a little bit of breathing in, you're going to start to see the stomach swelling up. Take a moment to just decompress the stomach, because a little bit like bloat, when you have an enlarged stomach, it's compressing upward on the diaphragm, which is further impairing lung function. Hopefully there are 2 people doing this, and then it can be your 100 compressions per minute and your 10-12 breaths per minute. But it might be 1 person, in which case all that you do is alternate. So you're going to do like 30 compressions, take a moment, do 2 breaths, another 30 compressions, 2 breaths, and maybe they'll come back. However, of course, this is a huge subject, and why would I only spend about 90 seconds on it? Because of the prognosis. Actually, as was mentioned toward the beginning, animals don't usually have the same reasons for arresting as people. You know, with people, it's usually a cardiac problem, right? And you have a pretty good chance that if you can get them going again and get them into the emergency room, that they can get stabilized and then they can get treated and they're going to come home. But with dogs and cats, it's not likely at all to be a cardiac problem. It's going to be a ruptured diaphragm. It's going to be some fatal injury. It's going to be something that is not going to have a good outcome no matter what. So the statistic that we have that I've given you is survival is 2%. And what I mean by that is if you get them going again and you get them to the hospital alive, 2% will come out alive. So, I mean, it's really even lower as far as the percent that you actually even get going again. So what I mean to say by all of this is such a downer, isn't it? But the reason I say this is because I want you to try to do CPR if it's indicated, but I want you to know that it's not likely to work, so you don't ever beat yourself up about that failure. Because when an animal dies, we feel horrible. You know, I mean, God, what did I do wrong? How could I do this better? And so you should know, yes, try to do CPR, but also know it's not like CPR in your human patients. There really is a much lower survival. And so, again, do what you can, and then don't beat yourself up if it doesn't work.
Is CPR in animals actually physically as effective as doing it in an adult, or at least in a person? Meaning, like, does it actually circulate blood flow?
Then
in a
correctly,
similar manner?
absolutely.
Yeah.
Oh, for sure. Yeah. Yeah, you should see the gums turning pink again. You really should. Yeah. So on that cheerful note, on the last page of your handout, there's a list of what is good to have on hand for emergency supplies. And I give you those normal values that I would suggest again, that you just cut that out, laminate it, keep it in your first aid kit. And I think we should all take a little break. I've gone way over how long I meant to. I'm really sorry about that. But you guys have had such great questions. You know, it's really cool. Let's do when you have an injured cat. Because the first thing I'm going to talk about is handling them safely. And what you need to do with a cat is make it so that they can't see where you're coming at them from. I try to, like, if it's in the middle of a floor, I'm assuming I have an injured cat or of some kind, I would try to kind of like herd it to a corner, and then I throw a big towel over it. If they can't see where I'm at, and they already are in a corner, then there's no way for them to get away. Then I can get down there and bundle them up and do what I need to do. It's tricky with cats because they have so many weapons. So I will say it takes a lot more professional training to do good cat restraint than good dog restraint, that's for sure. But yeah, you've got to be mindful that they will use everything they've got. They're awfully good if you're doing something at their head and using their hind leg and coming up and getting you. So you've got to do a total body wrap that immobilizes all their limbs. Right there, Seth. Okay, so like I said, the closer you can get, the safer you are. So I do like to get them in a sitting position on the floor, and then a great big hug. And oopsie, it can be. I don't want to really forcefully restrain her the way that I would do in a clinic. Maybe you demo it. Yeah, the tight hold like that is great. And notice that what he's doing is actually making it so she can't turn around. You know, a hurt animal is a dangerous animal, right? So you probably don't have a muzzle of every size in your kit, but you're going to have some gauze. Ideally not stretch gauze, but even if you have to use stretch gauze, okay. And what you do is you get around the head. Now you will have to have somebody holding them still because they're going to immediately back out of this. But you do one throw on the top of their nose and snug it really tight. Not so tight that it comes off. She has the wrong shaped head.
This
But-
won't work for brachycephalics.
No, exactly. It won't work for brachycephalics. And then the key thing is that people don't understand they need to do is a throw on the top and a throw below their chin. And then behind the ears and do a bow tie back here because you want to be able to take it off fast. But that is a fabulous muzzle. The key again is a throw on the top and a throw underneath. And as long as someone has held them still long enough for you to do it, won't work on a cat and will not work on a smushed faced dog. So if you go for the wrist, you probably can't get enough of a pulse. So what we typically use in the animals is the femoral arm.
Just, you find where the femur is, the femur bone, and you're taking your hand and going up and kind of
Limb.
Yes.
And your first problem is going to be keeping the bandage in place as you bandage. Even if the animal isn't moving, again, it's so slippery that you're going to have to always be really holding as you wrap. So you're going to start with your non-adherent layer, their wound, and you've been able to clean it. And so then you want a non-adherent on it. And then cushion that with some gauze. Okay? So you take some gauze and get right on top of that.
Sorry, what is
With
what
gauze,
is the bottom layer?
Telfa pad, and any kind of a non-adherent dressing here. This is, you can get these in the drugstore. Anyway, yeah, right? Because this will not stick to the wound. So that way, when you do come to taking it off to do a bandage change, you won't be so much disrupting the clot. So that goes on first, and already as you get this layer on, you're going to find it's incredible how much it wants to slip out of place. So you've always got to kind of find a way to bandage where either you have a second person holding things in place for you, or you manage to do it with one hand while you're holding with your other. That's your second layer. How much of the gauze you put on depends on how much bleeding you're anticipating or fluid exudate of any kind. And then you're going to put your stretch gauze on. We use stretch gauze much, much more than non-stretch. You want to start this about a half a roll width above your telfa and gauze and go around. And here's where your bandage will usually starts to slip in the direction you're wrapping. So I'm going to hold from this side and start going around. Okay, everybody with me on this? Get some layers around. And then again, how much do I wrap with this? Well, that depends on how much exudate I'm expecting to see coming out of the wound. So I'm going to give this a good wrap, and then I would cut that. Your next layer is vet wrap or Coban or anything like this that you can get. All the pet stores, pet supply stores all have this now. Now here's the one layer that I think is critical to get really right, because this is the one that will tend to wind up constricting too much. And we were just talking a minute ago about how when you bandage a horse, you pull this tight and you wrap tight. But if you do that on a small animal, you will immediately constrict. So what you want to do is unroll it and then roll back up and then just lay it flat. Just lay it flat. And this time you're going just slightly above the top of your stretch gauze, okay? So that you kind of totally enclose your stretch gauze. This is a little messy because I didn't cut my stretch gauze, so I have a roll there. But you're wrapping this around. Typically about a half a roll width of overlap. If you want to do more than that, if you want to wrap, more closely together, that's fine. But don't wrap more farther apart. It is getting late, isn't it? Don't wrap farther apart than that. And again, you're going a little past your gauze at the bottom, so that all that shows now is your vet wrap. Your inner layers are completely concealed, which means that they're completely protected. Now this is not waterproof, and you don't want to use waterproof bandaging. And then your final layer is the white tape that's going to keep this from slipping. And it doesn't come off of this kind of fur well, so I'm just going to pretend. But you're going to do once around that's completely on the bandage, and then carry that up, continue going around up until you're a good bandage, a tape width above the bandage. Maybe even more, depending on how slippery you think that spot might be. And do below.
So you're taping right onto the fur?
You're taping the bandage to the fur here.
Okay.
Okay? So above and below. And that bandage hopefully will stay. If it comes off, then do it again with much more white tape. Because again, I can't say it enough, the problem is the bandages slip off. They just do. And so you have to just be aggressive about attaching it to the fur. Worry about getting it off later. Although, as we were talking about a minute ago, there is a limit. You're reaching for whatever you've got handy, but don't use duct tape. If you do use duct tape, you're going to have to cut the fur to get it off. And if you've got a short-furred animal, that might even be tricky. Me too, and I'll tell you, it's inhumane. It's just inhumane. If it's more than like 4 or 5 kilos, I just really don't put it in because it's super painful, super terrifying. It's traumatizing for animals. So, no, they need general anesthesia. And, it turns out, you sedate them, and we were talking with somebody about this too, because you mentioned that, the I sedated the dog, started to pull clothes on the dog, and made her lunch off the table.
Snug with it, because it's not a stick.
Again.
Yeah, I
Go
It's
fly
just a
once or
temporary
twice,
bandage
and
for
then
now.
I let it